All right, let's look at the treatment of cardiomyopathy based on the physiology of the disease. And to do so, I'm going to just draw here a simplified diagram of the cardiac system. So I want you to think of the cardiovascular system as the heart as a series of two pumps that are separated by the lungs up here and the body, and kind of think of the body as two tanks. So over here on the left side, we'll have just blood filled in this tank, and this blood enters into the right heart, and the heart pumps this blood to the lungs. And in the lungs, the blood is oxygenated, and it returns to the left heart, where it is then pumped back to the body. And if you think about this second tank, the heart has to pump this blood enough to get into this normal range. And so these dotted lines here are going to represent a normal range in order to get that blood adequately out to the body where it is used. And so here we'll kind of demonstrate this mixing of blood with kind of maybe a purple color used by the body, so organs like the brain and the intestines and the muscles and everything. And that blood now is deoxygenated and returns back to the heart here. So that's how I want you to kind of think of a normal flow of blood in the cardiac system. But in cardiomyopathy, you have a failure of this system, and when it fails, the heart is not able to adequately pump blood out. So this here is decreased, and when you don't get an adequate outflow of blood, this tank isn't filled to a level that's able to adequately perfuse the body. And then also over here, if the blood isn't coming out of the heart because you have a heart failure, it's going to get backed up in this tank, and this tank is going to be overflowing. And so if you think of cardiomyopathy in this way, you can see three areas in which the disease can be treated. So in the center here, the main cause of cardiomyopathy is that you have a pump failure. And then over here on the left, you have this backup of blood flow. And then over here on the right, you have a decreased outflow. So if you think about it this way, you can see the three major targets of how cardiomyopathy can be treated. And for each of these three mechanisms, I'm going to talk about a few different treatment options and whether or not and what types of cardiomyopathy they pertain to. So I'm going to just write in the types of cardiomyopathy here. And I'll use DCM to abbreviate for dilated cardiomyopathy, and RCM for restrictive cardiomyopathy, and HCM for hypertrophic cardiomyopathy. So let's start with treatments that address the backup of fluid caused by this heart failure. And the first thing that someone with cardiomyopathy can do are lifestyle changes, such as a low-salt diet. And salt is made up of sodium, and sodium is what determines the amount of fluid the body retains. So if you have a low-salt diet, the body will try and get rid of this backed-up fluid. And this is a primary treatment for both dilated cardiomyopathy and restrictive cardiomyopathy. And if a low-salt diet is not sufficient, diuretics can be added to the treatment regimen. And diuretics have the same effect, but although they're more efficient at decreasing this backed up blood flow, and so that's also used in dilated cardiomyopathy and restrictive cardiomyopathy. The last medication I want to mention here for treating the backup are ACE inhibitors. So they are also used in dilated cardiomyopathy and restrictive cardiomyopathy. And notice that none of these treatments are used in hypertrophic cardiomyopathy, and that's because hypertrophic cardiomyopathy only results in symptoms intermittently, and so individuals with hypertrophic cardiomyopathy don't typically have these signs and symptoms of fluid backup, and so that mechanism does not need to be treated. All right, let's move on to the pump failure and treatments that directly address what's going on in the heart. And the first one to mention are two types of medications that have similar effects. So those are beta blockers and calcium channel blockers, which I'll abbreviate CCB. These medications are used in both dilated cardiomyopathy and hypertrophic cardiomyopathy, but they're used for different reasons. In dilated cardiomyopathy, beta blockers and calcium channel blockers decrease the oxygen demand of the heart, which can decrease some of the symptoms when the heart is overworked. However, in hypertrophic cardiomyopathy, these medications treat the disease by a different means. These medications also slow down the heart rate. And in hypertrophic cardiomyopathy, this is important because a decreased heart rate increases the time in which the heart is spent in diastole, or the filling phase. And so then when it contracts, there's an increased outflow. And the next medication here is digoxin. And digoxin isn't used all that frequently, but it can be used for dilated cardiomyopathy. And what it does is it increases the contractile strength of the heart muscle to overcome this pump failure, and it's really only used in dilated cardiomyopathy. So these are the medications that are used to treat the pump failure, but there's also a few devices or procedures that can be done to treat the pump failure in cardiomyopathy. And the first one I want to mention is a pacemaker. So a pacemaker is a device that is actually implanted into the heart to make sure that the heart beats regularly. In dilated cardiomyopathy and restrictive cardiomyopathy, the disease can become so severe that the conduction pathways that cause the heart to beat regularly can become dysfunctional, and so a pacemaker can be used to improve the heart's ability to beat on a regular basis. So that's used to treat dilated cardiomyopathy and restrictive cardiomyopathy. And the next treatment of the pump failure is something known as septal reduction. And septal reduction is only used for hypertrophic cardiomyopathy because hypertrophic cardiomyopathy is caused by this asymmetric enlargement of the ventricular septum. And if you reduce the size of the septum, you decrease the severity of disease. Or it can be done surgically through a procedure known as a septal myomectomy. And the last treatment for pump failure is a transplant. And so a heart transplant is really a last-ditch effort to treat any of the forms of cardiomyopathy. So now let's move on to this last target of treatment, which is the decreased outflow. And there's really only one medication that's used on a regular basis to specifically treat this mechanism. And that, we actually already mentioned over in the backup, is ACE inhibitors. And what ACE inhibitors do is they cause dilation of the arterioles here, which decreases the resistance in the arterial system of which the heart has to pump against. And so for the same contraction strength, you can get an increased outflow from the heart. And this is used to treat, once again, dilated cardiomyopathy and restrictive cardiomyopathy. So this is just a brief overview of the treatments of the different types of cardiomyopathy. And if you can remember this simplified diagram of the cardiovascular system and how cardiomyopathy causes a pump failure with subsequent backup of fluids as well as a decreased outflow, you can remember that there are three main targets of the treatments for cardiomyopathy, and they vary somewhat depending on the specific type of cardiomyopathy, whether it be dilated cardiomyopathy, restrictive cardiomyopathy, or hypertrophic cardiomyopathy.